Hi, my name is Claude Fortin. I am the co-chair of CanSAGE2018 meeting, which is being held in Banff. CanSage is the Canadian Society for Advancement of Gynecologic Excellence. I'm here today with Dr. Phillippe Laberge. Dr. Laberge is a good friend of mine. He was one of our first speakers of today. And welcome, Philip, and thank you for your talk. That was very interesting. Could you tell me a little bit about your academic background and where are you as of today as a gynecologist?
Sure. So I did a fellowship in endoscopic surgery way back when there weren't any fellowships in North America. So I went over to France and in Germany as well. And so since 1990, I've been doing mainly laparoscopic and hysteroscopic surgery and working in the academic center, being chief of the Division of Gynecology and director of the fellowship program now. I've always been involved as well in teaching and research in the field of endoscopic gynecologic surgery.
This is what you're doing and this is what you love.
Right, this is my passion. The surgery is like giving me toys in the kids' Toys R Us.
Absolutely.
So I feel at home in the OR.
Well, that was a good talk today, as I mentioned. Our topic was MIS, medical legal aspect, and I know that you had to talk about the surgical aspect. Could you summarize about your talk?
Sure. Actually, the medical legal aspects is a significant one. Being involved in as an expert for the plaintiff or to defend colleagues in medical legal situation, I've come up to realize that there are three main areas where we can get sued because there was a mishap. One is preoperatively with the informed consent. If we don't have a proper informed consent and documented informed consent, that's certainly an area where there's improvement to be made. So I made a point about that.
Yes.
Intraoperatively, where most of course of the litigation comes up, it's all about surgical awareness, how to anticipate cases that are going to be difficult, how to prepare for them, how to recognize a complication when it happens, so that you don't have the complication of the complication, which is what gets you into trouble medical legally. So if you have for example, a bowel trauma, but you recognize a bowel trauma and address it right away, then most likely the outcome will be uneventful. But if you don't recognize it, it may be more difficult. So that's the second part of my talk, was on intraoperative recognition, avoidance, and recognition to mitigate the outcome. And thirdly, the postoperative complications. Patients who have had laparoscopic surgery should improve on a day-to-day basis. If they don't, you should be worried. You should come back to this should not be made over the phone. They should come back to the hospital, have them re-examine, make some tests, and in case where you're not sure and the patient is not improving, you should go back to the OR and find out for sure if there is a bowel leak or a urinary trauma that you did not recognize intraoperatively. We have an obligation of means of trying to be the most prudent physician. So a patient that comes back postoperatively complaining of something, especially in the first few days, don't dismiss it. Take her complaint seriously.
Yes, I was there, and you were talking after Dr. Lefebvre, who was working with the CNPA. I know that you've given this lecture many times. I know that you're an expert. Here is an expert audience. Do you see it brought to another level? I mean, do you see your way to see that, to do things being brought to our gynecologists that are not going to meetings? Do you see any way to transport that, that we can reduce the complications, that we can reduce the suits that the people are getting?
Mm-hmm. Certainly the medical legal aspects implies or involves all gynecologists, not just the ones that are expert and do difficult cases. Actually,
Yeah.
oftentimes the litigation arises from a simple case where there was an unexpected complication. So I agree with you, Claude, that this kind of talk on the medical legal aspects of surgery can certainly be diffused to all gynecologists to make them aware of where are the areas to really be careful and improve on. And every surgeon, every gynecologist has their own threshold of comfort level, if you want, in terms of surgery, where one has to really either improve this threshold or realize where it is and ask for help. So it's simple things, but awareness is really the key here.
The key here, that's right, because some of our colleagues, are repeatedly being sued, and those are the ones that we would like to involve, in lectures like you
Certainly,
have.
and the provincial licensing board, they should also play a role in facilitating the diffusion of this kind of lecture, because it's in their own interest to protect the public.
As well as the CMPA, as we were mentioning. Thank you very much, Philip. Your talk was excellent, in spite of some video kind of things, but as an experienced speaker, you've done very well. Thanks a lot.
Thank you.
Thank you very much.